Part 3, Documenting Common Interventions. Now we're going to talk about some specific examples of assessments or interventions that you may be charting when you're caring for your patient. Remember, we have put our list in alphabetical order. If we do default to the next due, we see vital signs comes up due fairly soon. If we change our interventions to alphabetical, we have to scroll down to the bottom to find vital signs. And we are going to document vital signs, an ID check, pain assessment, safety assessment, and activities of daily living. Since many times we think about pain as one of the vital signs, let's do that in vitals together so I can show you that you can document more than one thing. So I'm going to check mark pain assessment, and I'm going to come down and check mark vital signs assessment. So with those two things check marked, we're going to click document at the bottom. You see we have a go-to list again with vital signs and pain assessment. Let's do the pain assessment first. So we're going to click on that, and the pain assessment screen opens. Again, we've got the same square and round choices as well as rectangular boxes. Let's say our patient has pain or an owie on his left abdomen he's complaining about. And maybe you could also modify it further of upper or lower. He just may kind of be saying owie. At his age, we would use the appropriate pain scale for his age and development. We'll say maybe he can help us with faces. And when he points to faces, we get a pain score of 4. So we're going to say, okay, what's the pain like? Well, a 2.5-year-old can't characterize this. So over here we have the choice unable to characterize. Otherwise you would use the rest of these. Frequency of pain seems to be with palpation or movement. Doesn't seem to bother him otherwise. He's grimacing, he's guarding, he may be crying when you touch it. So you're trying to reposition him and distract him. And if you notified the doctor that was what you were going to do, this is where you type in the doctor's name. So that's doing the pain assessment. Let's do the go-to to get back to our list and pull up our vital signs. So vital signs are due. There are some reasons to defer it. But for the most part, you're going to do your vitals when they're due because that's your baseline. So these boxes are rectangular even though they have color in them. You see reference ranges. We're going to enter our temperature, so we're going to click anywhere in that box. The number pad comes up. You can either use your keyboard or let's say our patient's temp is right at 38. We say OK. It still falls in the green range of the reference range. It converts to a calculated Fahrenheit, and we did it by tympanic. Let's say his pulse rate was 112. So if we click in this box and put in 112 and click OK, you see that falls right in the middle. His blood pressure was 96/66 in his right upper extremity. So we're going to enter these the same way. It will not figure a mean. This is interesting. Sometimes your source will be in here. And if you need to clear that source, click in there because we didn't do an arterial. Let's discontinue the occurrence. It opens it up and it lets you say, no, actually this was an automatic cuff. We used the small child size. He was sitting on mom's lap and he was quiet when you took it. His respiratory rate, because he's here for asthma, is up at 58. You notice now we're in the red range. His oxygen sat is 96%. So at this point, primarily because of the respiratory rate, you're going to notify the bedside RN. So now if we do a go-to, we see both of them are purple and we are done. So we're going to click done. And here's again where you would need the password to save it. Having done those two together, let's do one intervention that you many times only do as a standalone, and that's the IV invasive line assessment. So you can highlight it and document, or you can just double click because it's a single one. We were in and did the 1100 one. We're going to say OK. Now, because it's already been charted on by someone earlier, you see that it's a peripheral IV in the right hand. If that's incorrect, we can discontinue the occurrence and clear that out. But that's where it is. It is infusing, and if you flushed it, you'd respond by check marking that it flushes easily, and maybe you use 3 mLs of normal saline to do the flush. Once we save that, this 3 mLs will go to the INO sheet. When you checked the site using the TLC, which is touch, look, compare, you have clean, dry, intact. Patient does have an arm board on. Remember, it's in his right hand. There's no drainage. We did flush it, but beyond that, we didn't do anything else. The patient cried but was consolable, so we don't need any extra comfort measures. And we, of course, did it per policy. Now, if you wanted to look up the policy, the View Protocol button down here at the bottom would take you there the same way the Protocol Connect on the Interventions board did as well. So we can either return and save, or we can save directly here. Let's continue to return and save. There's your cosign, and we would take care of that and be done. Now let's do the activities of daily living charting. ADL Assessment happens to be right at the top for us. This time let's do it's highlighted green already. We can just click Document. Let's say we did it at 1100, say OK. Now, to define this, you can look down below. You're going to figure that our toddler is going to need assistance with some of this. So that would be a moderate. His positioning, he's pretty much unassisted to move around. You have some moderate feeding assistance because you still have to kind of help him with his eating a little bit. So then you have a choice on bathing assistance. Are you doing a CHG-based bath or a non-CHG? In our case, we're just going to do a bed bath shower without CHG. We helped him to get dressed, both upper and lower, into shoes and socks. Teeth brushing was at the bedside. We assisted him from sitting to standing to get up and go to the bathroom. We're not having to assist him otherwise. Right now he's just walking in the room. We're using the communication board that's in the room. The family has been trained in mobility. That would be Mother Mary and Father Joseph. And then any other comments you would want to type in. So at this point, let's go ahead and save right from here. And here's your cosign again. The documentation screens we're going to look at in this video have to do with safety assessment. And so if you scroll down the list, you will find the safety assessment bundle. You'll notice that it's once a shift at the start of the shift. And so we're going to double click on it to open it up. There is actually a bundle. The continuous lateral rotation is a special bed that is used in PICU, so you shouldn't usually see that. Our patient is under 12, so we don't need to do the VTE risk screen. So that leaves us safety assessment and risk screening assessment. So we're going to click on the safety assessment first. And once we get into this screen, you need to say what type of bed the patient's in. And because the patient's under 3 and over 6 months, he is in a crib with a hood. We had elevated the head of our bed for our patient to 15, so click in that box. Use your keypad and hit enter, or use your mouse to click on the boxes. Temperature probe doesn't apply. The safety measures we're taking for our patient. Our side rails are up, wheels are locked, the hood is in place. We have fall prevention measures of other types. The head of the bed is elevated. The parents are in the room. If the suction canister were due to be changed, you would go ahead and document it here. Our child is not due, nor is it full. If there were a bulb syringe or other nasal suction device, you would change it here. Then scrolling down under alerts, we know that he has a moderate fall risk, so we could check that. Pretty much everything else does not apply. Then ask about any medication patches present. You'll notice there's 2 questions about that with a placement if there is present. So we only answer the first question, there is not one in place, so we don't have to say where it is. And the same thing on the second question. She does not have seizure precautions. She is on standard isolation. Our patient's armband is on the left ankle. Because he has some allergies, we have a red allergy armband on him as well. The emergency equipment that would need to be at the bedside would be a suction canister with tubing, suction catheters. The emergency wall box should be sealed in full. We have that bulb syringe. We have a Yonker suction in case. There's an emergency drug sheet on the wall, and it is correct for this patient. And that would be it. Our patient is not on a monitor, so we can skip all the alarm limits and alarm safety. Now we're going to use Go-To to get back to our bundle list, because we still need to do risk screening. We're going to click on that, and this is where those alerts come from on your status board, is if you check mark any of these items, starting with the family is concerned about something, on over to signs of abuse and neglect, other risk behaviors you might see. For our patient, there's no risk observed. We don't need to do a social service referral or a child advocacy referral. Child advocacy is child abuse and neglect prevention. We'll do a quick nutritional screen. None of this applies on our patient, so we're going to say adequate weight, so we don't need a dietary referral. Now when we go back to our Go-To list by hitting Go-To, we can now say done and save, or let's go ahead and use the shortcut and save right from here. Here's your student password again to get someone to co-sign. Recording a linen change or patient hygiene are done using the following 2 interventions that you see checkmarked here: patient bath hygiene and patient linen change. So with both checkmarked, just to show you, you may only use one or the other. Click on document. Let's go ahead and do the patient bath hygiene first. This is, did you provide a bath? Yes. What type was it? Just like in the ADL assessment, non-CHG versus a CHG. We're going to use non-CHG because our patient doesn't have a central line, is not going to surgery, etc. Then if you did any other items like washing hair, or maybe all you did was peri-care when you changed a diaper. If it was offered and declined, you note that here as well, and that you notify the bedside nurse if bathing was declined. And then you would put the name of the nurse, for instance, and nurse RN, as who you notified. Just continuing so you can see the other screen. Again, you may do these separately. The patient linen change is the same way. We did a linen change with Phil, but if it was declined or deferred, you would note that and you would note who you notified. And then at that point, we go back to our Go-To list. We say we're done, and there's our trigger to give it cosign.